continuing with the theme of doing footwork. So usually when you're working on the reformer, you've done footwork with both feet on. And then at a certain level of accomplishment, a certain level of you in your personal practice, you'll transition to single leg footwork. And you're going to do the exact same thing here. Now, doing single leg footwork puts particular demands on the human body. Now, it's important for you as a teacher to understand what those demands are, and it's important for you as a practitioner to know that this feeling that you're going to have is not something abnormal and you're not doing it wrong. So I'm going to have Natalie put one foot, like the heel of her one foot onto this pedal, hands holding onto the seat for safety, and she's just going to push it down slightly, the other leg comes out of the way. Now, this leg, preferably, is perfectly straight, toes pointed, and you want to make sure and double check that they're sitting up nice and straight. Now, here's the thing. Myself, I actually have to stretch before I do this exercise because my hamstrings are tight. So therefore, unless you've got a client or if you yourself are extremely flexible, like a ballet dancer, you're probably going to see that the leg is going to start to droop. What that means is that we don't want you to cue this leg absolutely straight, and that is the criteria of the exercise. Because if you cue this leg straight and you deem that, you know, if this leg isn't straight up right here and you're doing the exercise wrong, well, what happens here is check this out. If I deliberately lift her leg up super high, I don't care how strong your client is, the lower back is going to round and is going to be out of position. So what I want you to do is prioritize having your client's spine erect first. Listen, if you want to stretch the hamstring, you can stretch your hamstring out just sitting in your living room, stretching out your hamstrings. That can be done anywhere. The value of this exercise is that you're seeing if you can keep all of this wonderful postural work being done in the hips while giving this challenge. So therefore, prioritize this first. What that means is if your client brings that leg out and it's a little bit drooping down, I'm okay with that. So let's have the leg slightly down here, whether it's straight and down, or if you want, how about you bend it a little bit and then you sit up straight. Now you have your client start to pump this pedal. And you have the same criteria. You look at your client here, or you look at a mirror yourself and make sure that your hips are stable, both on this plane and right back here. In a certain way, what you're doing is that having this single leg here makes it so that the tightness of your hamstring places a restriction on your pelvis. The other thing that's happening is quite obvious, is if your client or you are only pumping the pedal with one leg, you can't cheat by using the other leg. Even if you have somebody doing the best of intentions and you tell them, hey, put both of your feet on the pedal and then try to have 50-50 exactly equal amount of pressure on your feet, it's not going to happen because you have a dominant leg. So unconsciously, if I put little sensors underneath her heels, chances are if she's putting like so many newtons of force on her one heel, the other heel is having just a little bit of discrepancy, even if they're the most athletic person in the world. If, however, they take one foot off of the pedal, there's no way that this leg is helping that other leg, so you will have at least a chance that this leg is going to be working by itself. So once you've done this, you can obviously choose different foot positions. So try this. Place your arch of the foot onto the pedal instead. Have this other leg up. And you can challenge your client to say, hey, get that leg up as high as you can. Now, obviously, if you dorsiflex or flex this foot, it's going to have a different effect than if you point the foot. So having the foot pulled back is going to make it a lot tighter along this rear line than if the foot was pointed. And then after you do that, try this. Go onto your toes on that foot. As you can see, we're basically replicating the same progression of work that you would be doing on the reformer, but on your footwork here. So all of this does change the range of motion. It changes the experience. It changes the type of muscles that are being worked. So you're not just throwing a variety of exercises at your body just for the sake of variety. There are physiological differences. Now, the other thing that I'd probably have you do is put your feet into a V. So here's how I like to teach it. I have my client put their feet in a V first. And once you have that, notice the precise angles that you're coming out here. So I want you to pick one of your legs and extend that leg at that angle. Now what you want to do as a teacher, or if you're a Pilates practitioner, is look here at these angles and maintain that as you push up and down. What will often happen is that as you do this, this leg will start to drift right in towards the center because it's easier. All right? So therefore, you have the leg out. Now, if you know from your anatomy, pause and rest for a second, if this leg is turned out and off to the side, the hip flexor has much greater leverage. And so now we're going to start coming full circle. Where you are going to feel this exercise is significant hip flexor activation. Your hip flexors are the muscle that's being used to lift up this leg. So therefore, you're going to feel a whole lot of work right here in your hip flexors, and you're going to feel a tugging right here in the back because that's where the hip flexors attach into your body. So just realize that if you're going to tackle this exercise, you're thinking in your mind that the leg that's pushing down is the one that's going to get the lion's share of work. And it is doing some work as you push up and down. However, just realize that this other leg, because you're holding it up in midair, the muscles that are holding that up are getting a workout. And teachers, if you're teaching this exercise, very commonly, if you do this, your clients will almost immediately say, "Woo, I feel this right here in the front of my hip." And your answer would be, yes, that is the muscle that's being used to hold that leg up. So it's something that you should anticipate. And if you're doing the exercise, you want to anticipate that as well. There's nothing wrong with you, or wrong with your hip, or wrong with the exercise if you're experiencing that muscle being active. So there's your footwork. There's one other variation that we might want to do. Place your heels wide onto the pedal. And if anything, that gives even more of a disruption to the hip, because if you have your leg way off to the side, it's going to make it a lot harder for you to keep your hips stable. So pick one leg and bring that off to the side, and notice how this knee collapses inwards. So you really have to work on pushing that out so you don't get what's called a valgus fault on this knee, meaning that the knee collapses inwards. Now notice, even with how strong Natalie is, she's struggling. Let's have you sit up. So here's where pushing down and back with the hands against the seat, just with a little bit of pressure, can actually give enough assistance that it's going to help her to keep her presence and keep her posture during this exercise. What you're thinking of is outer thighs are on to keep the leg turned out. That leg is also turned out. Hip flexor is on, and you're working in order to keep everything in the pelvis steady and level. And then, of course, if you want to take it to the next level, you can have your hands up. Now note that I've got right back here a spring setting of 1 spring on this machine at number 3. That, with a single leg, is quite difficult because you're not using just raw leg muscle right here in the quad to push down. There's a whole chain, a kinetic chain of events happening from the foot all the way up towards the spine, or vice versa, going down, however you want to think about that. So therefore, do not make the mistake of doing leg work with both feet, having heavy springs, like both of the springs on, which is entirely appropriate if you have both feet on the pedal. Make sure that when you're doing single leg work that you change your spring setting, or else that you may actually strain some structures in the knee when you do this exercise at a higher spring setting than necessary with one leg. The finesse, the precision, the delicacy of using this with one leg, that's the thing that you want to promote rather than how much weight you can push. So there's your single leg footwork on the chair.